morning. Dr. Patino here at the Cosmetic Surgical Center of Rosarito. We're going to do micro power assisted liposuction to the abdomen and back. We're going to do the buffalo hump also. And we're going to do the arms and all these areas. No fat transfer to the buttocks yet. We're going to do the suprapubic area, which is right here. But notice how I'm going to turn on the micro power assisted liposuction, and we're going to go into her abdomen, abdominal wall, and notice what comes out, right? What's coming out, Wendy?
Beautiful yellow fat as usual.
As usual, that's the key. And the reason why is because of my technique. This is a different, incredible technique. We're not going to do fat transfer to the buttocks, but it is still important to have a bloodless aspirate, so the patient has much less of anemia, blood transfusions, reoperations for bleeding, something that we never had to do. And in the case of liposuction, you can have these fibrotic bands that are painful, and that's something that has never happened to us. Dr. Guillermo Blugerman, my dear friend from Argentina, postulated that these fibrotic bands are the result of a central hematoma, and he calls this the octopus effect, where the central hematoma is the body of the octopus, and then the tracts of liposuction are its tentacles. And that's something that has never happened to me, thanks to God, but those fibrotic bands can be painful and difficult to treat. He has a way to treat them himself, which involves dividing the band with suture. Very ingenious. He's a genius, Dr. Blugerman. Greetings. Yeah, but I believe the best thing is to avoid those bands, you know. So in our case, we never have them. So those painful bands that octopus effect that Dr. Blugerman is describing is because the blood is irritating to the tissues, and it creates this reaction inside, you know. And so we don't get them to begin with. We prevent them. See? We prevent the car crash, right? That's the key. And the micro power assisted liposuction is a power assisted. So this is basically like a blender, right? Where you don't have to go in and out very fast. You know, like if you're blending butter, for example, the butter, which is similar to the fat, you could just get a stick and beat it. That's traditional liposuction, right? Power assisted means you put it in a blender, so the surgeon doesn't have to do all the effort, right? The machine works by itself, right? And you can go slowly. You can also put it in the microwave and melt it, and that would be similar to, say, for example, ultrasound assisted liposuction, right? Or the famous Baser, right? And you could put it in the fire, you know, like in the stove, right? And that would be similar to doing, for example, smart lipo-assisted lipolysis, you know, like smart lipo, where the laser, you know, burns the fat, melts the fat, you know. Those last two, the Baser and the laser, because they have thermal energy, can burn the patient. So you have to be, you know, attentive to the temperature as well. But those are mechanical devices. This is a mechanical device, and those are energy-based devices, right? And there's many. There's many energy devices to you know, to create a skin retraction, you know. But in my opinion, the best thing is to operate on somebody who doesn't have excess skin to begin with, right? For these patients, we already addressed the excess skin by cutting it out, right? So now there's much less risk of irregularities because we are not depending on an energy device to shrink the skin, right? We already took care of all the excess skin, and now we can comfortably do an extended liposuction. Now, she doesn't want to do the high definition, so we're just doing the suprapubic area. This is where the pubic hair is here. And we're doing all these areas, but we're not going to give her the athletic lines because she doesn't want them. So not everybody does want those. And so she wants to have these more feminine look, if you would. And that's fine with us too. And so look at that. See the beautiful golden fat, not a speck of blood. So these would be awesome for a fat transfer, although she's very happy with her bottle. She doesn't want a fat transfer. But if you were going to transfer these fats, this beautiful, bloodless, oilless aspirate would be fantastic because it would limit the risk of oil cyst, something that we never had. And an oil cyst basically is that the surgeon breaks up the cells, if you would, and the oil leaks out. Imagine it that way, right? And then, of course, the oil doesn't belong in the buttocks. It doesn't belong there. So the body reacts to it and pushes it out to the surface, creates like a capsule around and pushes it out. Or the famous blowout fractures. So I spoke about these, and my theory of a blowout fracture is, I spoke about this as yeah, so I spoke about this in San Diego recently. I have a theory about how those blowout fractures happen, the famous blowout fractures, but that is, for you, it's not a bone fracture or anything like that. We call it a blowout fracture, but what it is basically you have like a deformity in the, look at the beautiful fat, right? You have a deformity in the contour of the buttocks, usually around. So a blowout fracture is basically an abnormal contour of the buttocks. It's like a light bulb sticking out on the side. And I believe it's also a foreign body reaction, similar to the body rejecting that oil that doesn't belong in there and creating an oil cyst. It does the same with blood that doesn't belong in there, and creates a membrane around it and it pushes it out. That's how it happens, and that's common also with when you do breast implants. You know, that's a capsular contracture. The body creates a capsule around that blood that doesn't belong there and encapsulates it. Thank you. Wow, what color is that fat?
With a golden yellow color.
Golden yellow, huh, Wilhelmina? Huh?
Yeah.
It almost looks like neon fat, without a speck of blood. This is incredible. So of course the patient is going to have a lot more energy because she's not going to be anemic. She's going to be woken because she doesn't have pain. She's going to be preventing a blood clot, which is the most serious complication that could be fatal. Thank God we never had anybody die. We want to keep it that way. But our patients walk out of the operating room 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. Thank you. So we're done with the belly, and look at, this is what we call the pinch test, see? Look at that, we're at 0.5 centimeters everywhere we go, see? You see that? 0.5 centimeters everywhere we go. This is just incredible, right? And the suprapubic area also. This is the vagina right there. This is the area of the suprapubic area. So everywhere we are at 0.5 centimeters. It's just incredible. Look at that, see? Thank you.